Worldwide, 1 in 4 people live with 2 or more long-term health conditions, which is known as multimorbidity. Usually, long-term conditions cannot be cured and need to be managed over time by care professionals and patients themselves. In England, about 70% of health and social care spending is related to multimorbidity care, and nearly half of all GP appointments are with this group of patients. In 2015, 54% of people aged 60 and over in England had multiple long-term conditions. That number is expected to rise to 68% by 2035. Although multimorbidity is fast becoming the major health challenge facing countries around the world, there is still a lack of information about how the local environment and community in which people live can impact their health and quality of life in either positive or negative ways. To fill this gap, researchers at the University of Southampton reviewed previously published studies discussing the relationship between these environmental and community factors and multiple long-term conditions. First, the condition of the environment in which people live impacts their health. Living in a property with damp, mold, poor ventilation, pests, or where a person might be in contact with chemicals leads to a higher risk of developing long-term health conditions. Second, people living in neighborhoods with high levels of air pollution were at increased risk of multimorbidity, compared with those where air quality was better. Third, living in an area of low crime, a close-knit community, or a neighborhood where there is access to the countryside, parks, or other open green spaces had a positive impact on people's health generally, although there was little information found about how these issues benefited those living with multiple long-term conditions. While these papers suggest that these environmental factors may increase or decrease the risk of multimorbidity, and also influence people's quality of life, the limited amount of evidence available makes it difficult to draw strong conclusions. Therefore, more research is urgently needed to better understand the relationship between a person's environment and their everyday experiences of living with multiple long-term health conditions.